Next up in our H's and T's review, hypovolemia. And we're talking about fluid loss. And fluid loss can occur from vomiting, diarrhea, sweating, fever. The body has lost fluid. Now, we have to think about this because what's our compensatory mechanism? What's going to happen in the body? Well, the heart rate's going to increase in an attempt to maintain our cardiac output, right? So your patient might be very tachycardic. Additionally, the other mechanism to raise blood pressure is peripheral vasoconstriction. Now, you have a hypovolemic patient, it might be very difficult to get an IV in them. IO. 2 attempts on an IV or 90 seconds and you go IO. So if you're thinking hypovolemia and you've tried an IV twice, go straight to IO. Now that's fluid loss. Another kind of volume loss is blood loss. And this carries with it another confounding factor in that we've lost oxygen carrying capacity. We've lost hemoglobin. Now, the reason hypovolemia made its way to the H's and T's list is because hypovolemia is often associated with PEA, Pulseless Electrical Activity. Now, here's a picture of a patient. Look at her skin, very pale, very pallor, and the textbook and the literature says to look for occult bleeding. Consider occult bleeding. Occult bleeding is bleeding you can't see. It's occurring on the inside. You can see around the endotracheal tube there is bright red blood coming out, and we were debating whether this was maybe esophageal varices or a gastric ulcer that let go, but there was profound blood loss. And in fact, this patient did develop PEA. Very tachycardic. Shortly after that she arrested. But there was PEA for a while. And remember, PEA is Pulseless Electrical Activity. That does not mean the heart is not working. And in fact, the heart may be working well. It's still contracting, it's still moving blood forward, but the cardiac output is so low, it will not produce a peripheral pulse. So how do you know if the heart's even working? Well, if the valves are opening and closing, you'll have heart tones. If you can't feel it, you might be able to hear it, so you can pull out a Doppler and try to find pulses with a Doppler. Bedside echo, and just do an echogram and look at the contractions of the heart to see if the heart is physically moving or not. So how do we manage this fluid loss, this hypovolemia? Well, if it's just fluid, we're going to replace it with crystalloid fluid. 0.9 normal saline, pretty much the standard. Follow your local protocols. Some are 200 cc's, 500 cc's, rapid administration of 1 liter of fluid. Again, anytime we're rapidly putting fluid into a patient, you want to monitor their lungs for fluid overload, but in a case of hypovolemia, we really got to tank them up quickly. So that's fluid loss. Blood loss, we have to replace the blood. So this has been a quick review of hypovolemia as it pertains to the H's and T's. I'm Mark, thanks for watching. See you in the next video.